As healthcare costs rise and access to quality medical care remains a major concern for Nigerians, the conversation around global healthcare and its impact on the country's economy is gaining importance. Joining us to discuss making global healthcare work for Nigerians is the CEO of AXA Mansard Health, Mr. Tope Adeniyi, as we examine whether true health really guarantees healthcare access and the common mistakes affluent families make when planning for their daily needs. Well, welcome to you, Mr. Adeniyi, and thanks for joining us this morning.
Thank you for having me this morning.
It's great to have you. All right, so there's this global perception about healthcare, and everyone's talking about how in Nigeria, for example, there's a conversation about access to healthcare. People don't have health insurance. People can't afford health insurance. Your company is a key leader in ensuring that health insurance is affordable and available to Nigerians. So how much progress would you say we've made so far in terms of how we've embraced the concept of health insurance?
Thank you very much. I think this is a very important topic in ensuring we have access to healthcare, structured healthcare in Nigeria. As you may remember, Nigeria Health Insurance Scheme started about 1999, but the adoption was slow until recent years, and thanks to NHIA, National Health Insurance Authority, for their drive for universal health coverage. And that is increasing coverage as I speak. We are now crossed overall over 20 million people for the first time in many, many years.
Yay, that's wonderful.
How many again?
Over 20 million people. That's me.
And growing.
Social health insurance, private health insurance, the central authority insurance, and all together over 20 million people. And of course, that's just less than 10% of Nigeria, which means that there's still a long way to go. So what AXA does, AXA Mansard Health, is to continue to play to ensure affordability, access, and inclusion. So in the way we have done it is to make sure that there is healthcare for every segment of the society. We do healthcare for the middle class, for the upper middle class, lower middle class, as well as every person, ordinary person in Nigeria. You have access to healthcare in a structured manner through health insurance. And you know that without health insurance, you will not be able to get a lot of people enrolled in proper healthcare system. In all over the world, it's health insurance that helps you to jump, to be able to have more access to healthcare. And that's why Nigeria is on that path. And we're driving inclusions. We want to make sure that in the next couple of years, you can have over 100 million Nigerians covered in healthcare insurance. And the way it works, once we are able to cover, as we have gotten a milestone as an industry of 20 million, it will take us fewer years to get to 50 million. And then it takes us fewer years to get 100 million. That's why you have the commitment of companies like ours we work together with government, with private institutions, with the press, with media, to ensure awareness, to continue to drive, adoption of, health insurance and make it remain affordable, accessible, and high quality.
Brilliant.
Interesting. There's this belief that wealth actually equals medical access. The more money you have, the more access you have to medical services. Do you think this is a misconception, especially looking at what is obtainable today?
Of course, you know that people say health is wealth. But I would not necessarily say that wealth means health. So the challenge you might have is that you can be wealthy today and healthcare condition that is very expensive might just throw everything, under the table and everything disappears. We have had situations where people who have been sitting in money and they are very comfortable, but they just have one serious health condition and everything disappears. Now, so wealthy people, comfortable people, rich people should plan adequately for their health care. You're actually not planning well when you have not planned your health care. I know people plan how they want to give inheritance to their children. People plan how to settle their loved ones. But if you do not plan for your health care properly, that means that there's something missing, because that wealth can just disappear over a very unfavorable condition for your health care or your family. Some new discoveries in healthcare intervention now cost a lot of money. And that's why it's very important. And I share with my colleagues and friends and everyone that, look, you may be rich, but you may not be liquid at the point of healthcare needs. And what does that mean? You have your riches, they're stored in properties, they're stored in stocks, long-term assets. And so suddenly there is something that goes wrong. How do you get liquid immediately? Do you want to borrow money and it may take you a couple of days? Imagine you have a treatment that will go up 500 million naira, maybe one very complex, new intervention on cancer or something. Even when you are very rich, but you may not be liquid at that moment. I gave a second example at a time. I said, look, imagine you have an healthcare condition that requires what we call emergency medical evacuation, in where you require an air ambulance to lift you from one point to the center of excellence. At that point, you are not very, you can't even sign a bank check. At that point, you cannot even tell somebody to help you move money. If you get cash at that time, I'm sure EFCC will chase you. That where is cash coming from at this particular point in, that kind of volume of cash. So what you require is if you have put in place structured health insurance system, like that kind of AXA, what we call IMED, which covers you, an air ambulance lifts you from that point where you are not even conscious to the next center of excellence. So even wealthy people must plan for their health care. Otherwise, it can become like your wealth is stored for nothing.
And there's sometimes you might even have that money and it can't do anything for you.
I want to still explore what you've said, because I remember some time when I traveled, I don't know if this extends to traveling outside the country. Sometime, I think in 2014-ish, I went to Dubai. I was going to have a good time with family. 2 days after, I had chicken pox. It was terrible. Wow. I was so sick. And having chicken pox as an adult.
In a foreign country.
In a foreign country. It's a terrible, it marred the experience of that holiday for me. So are we yet at a stage where we have insurance that covers your health even when you leave the country if you fall sick?
And that's very good because now we have developed in Nigeria beyond just local health insurance. Like from AXA, we are a global company, but very locally present. We are listed on the stock exchange. We are very strong. We call it GLOCA, meaning that you have global competence, but you are locally present. Investments in Nigeria. And what we have done is that beyond just being a local company providing domestic health insurance, we have also provided global health insurance. So as we were traveling to Dubai, if you have AXA IMED, it's a global insurance that covers you in Nigeria, covers you in Dubai, covers you in the US, covers you in Canada, covers you in Europe, all over the world. That gives you what we call healthcare without boundary, healthcare without borders. So you have, it's borderless, So that gives you access without worrying yourself about what to do. And that's both emergency basis as well as elective, which means you can even elect that to say you have seen a center of excellence that is more superior and you really want to be catered for there. And that's also a good development for us because we have now made healthcare in Nigeria to become a global center. So it means that you do not need to go abroad to buy a global healthcare insurance. Right here in Nigeria, you have access to global health insurance. With AXA IMED, you actually have access to everywhere in the world. People are actually now coming also to the country to have access to, on the supply side, the hospitals. You have very structured hospitals in Nigeria, both in the north, in the south, in the east, and the west, and they are springing up and they are growing. The same way healthcare insurance is also becoming globally accessible from Nigeria. And I think it's a very great one.
I mean, my next question is just a natural follow-up to it, because what you're doing is you're bringing medical tourism to Nigeria. People don't have to travel to experience quality healthcare. And I want to speak to the sort of treatments, quality treatments you can get locally in Nigeria. You have One Health, AXA Mansard medical centers in different parts of the country. Could you explain the initiative behind it? Is it owned by AXA Mansard, and do we expect to see, because I mean, my family and I are signed up to AXA Mansard, and the experience has been fantastic. Yes, it's been fantastic. My wife is actually working, and she can testify to it. So do we expect to see more of that spring up?
Very good, very good. And so AXA is a global organization present in 50 countries. Of course, you know about AXA. It's the top largest insurance company in the world, assets under management over 1.5 trillion US dollars. And AXA is very strong and then is very present in Nigeria. So in Nigeria, AXA plays in all the 4 businesses. AXA plays in health insurance, AXA plays in life insurance, in P&C, and now in One Health. One Health is the hospital side, where AXA is giving, as a vertical integration, helping ordinary person to have access to high quality care. So when you are health insured, you now have access to a global standard hospital where you have access to standardized treatment protocol as if you are in any part of the world. So Nigeria has become any very great center of excellence, whether you are like in London, you are in France, or in any part of the world.
But we need more of them. I'm just lucky that the one I go to is very close to my house.
And everybody should actually embrace it. We are currently in Ikeja and in VI. Lekki is opening November 1st, and it's going to be in Abuja and all over Nigeria. It's a way to ensure for us to see that the global standards are present in Nigeria going forward. So both in health insurance as well as hospital care access, we're making sure that Nigeria becomes a center of excellence across all the spectrum of healthcare delivery. And that's a good news, actually, that we are no longer just dependent on medical tourism abroad. We're actually becoming a center where other people can come in. And yet, with healthcare insurance from Nigeria, owned by AXA, International Health Insurance, you can use these services all over the world.
That's interesting.
Exciting.
That's interesting. I mean, a Nigerian is watching now. Nigerians are watching now. And what do you like to know? Some of them will say, yeah, what is he saying? What are they saying? These are people who are privileged, as it were, so they can get easy access to healthcare. What do you think needs to change to make not just healthcare available, but quality healthcare services available to every Nigerian?
And affordable.
And affordable. And affordable. Yes. It has to be affordable too.
I agree.
We understand it's a business, but yeah.
You know.
I agree. Actually, what made healthcare available, affordable, and accessible is health insurance. Health insurance is the proven system and structure that makes it. So if you contribute to your health insurance scheme, the premium that you pay is completely incomparable to the care you may likely access. The time you are paying the premium is comfortable for you. When you now need care, because some people will not need care at that particular moment, that's the benefit of insurance. So health insurance is what everybody must tune to. Think health insurance, plan health insurance, contribute into the health insurance, both the local one, and as you also, expand your income, do a global health insurance like HIMED, which AXA also promotes, which enables you to have comprehensive cover at all times, and it does taking care of the pain of having to pay out of pocket whenever you need it. And you don't need to be sick to use healthcare access. Your health check should be annual, sometimes twice in a year. You should be able to check yourself. Health insurance gives you opportunity for that so that you are doing a lot of preventive. You don't need to be sick to have access to the good healthcare. When you, maybe your spouse, yourself, you get pregnant, you want to have children, you're already covered. So very important information for all of us is just like we think and plan for our daily meals, we should think and plan for health insurance.
Very important, really. And I will applaud your, AXA. I believe that's what is covering Joe's gym subscription.
Yeah.
Very good.
Right? We find that it's beyond...
Oh, even gym.
Yes. Oh, you didn't know that.
Why didn't you tell me?
But...
I need 6 packs.
First of all, manage your 1 pack.
Sometimes they even put spa as an incentive.
Yes. But I wanted to ask, have we delved into the area of therapy as well with HMOs? If not, is that something that you're looking to explore?
So, there are different therapies, and they are all parts of...
For mental health?
Yes. So, there's something called EAP and general mental health. EAP is Employee Assistance Service, which is mental health, where you have to talk to a psychologist, a trained psychologist. We do that. We offer that also on our plans, and that enables you to be able to have care for people who need to talk to, a clinical psychologist to be able to take care of their mental health. This is already integrated inside the health insurance. That's why it's very important as a day-by-day thinking that you should have your health insurance card with you, both in number and physically. The reason why the physical card is also good is that just in case of emergency, you have accidents and they don't know who you are. That card, AXA card, IMED, AXA card, HMO card, everybody knows about that. It will take you to the nearest hospital. And it does not matter the kind of cover you have purchased. Once you have AXA card, it's an access to high quality care everywhere in Nigeria and everywhere in the world.
Okay, so for people who want more information, they're looking to maybe get on the HMO train. They've just decided, you know what, this is important. How do they go? What are the next steps?
Very easy. Go to axamansard.com. You will be able to have access to all the products. Download my AXA app. You also get access to all the products. And you can call our line 0700 AXA Mansard, and you have access to everything about the product, the solutions, and I will build this from cradle onto a very high pedestal of excellence in all healthcare value chain.
Thank you so much for
Trusting.
joining us.
Thank
And
you so
just to reiterate, it's very important to have healthcare. You can go for one treatment and pay maybe like, it can be one that would cost you so much as 200,000-300,000. And then you have healthcare. You know that the health insurance covers it. I will not lie, let me confess, I did it one time, I was ill. And then when I saw what it would cost me, I delayed a bit too. But then at the end of the day, I figured that even if I had gone, I don't know that the illness, the subscription would have then covered the illness. Would it have covered?
Would have covered you if you have already enrolled before.
Exactly.
Yeah.
So that's why I ended up now still paying out of pocket and then paying for my insurance immediately. All right.
Thank you, Mr.
Thank you so
Tope
much,
Adeniyi.
sir, for
It's
joining
been a
us.
pleasure
Thank you.
speaking with you.
Okay.